this program is actually your healthcare lifeline. Real secret. I'll tell you exactly how it works, and it might just change the entire view of healthcare in Canada for you. And that's what I'm sharing with you guys today. How we actually survived 5 good years in Canada, or almost 5 years in Canada, without a family doctor, and the secret solution that nobody actually talks about. Don't go anywhere, guys. You'd want to hear this one to the end. Let me shock you a bit today. I waited 4 years to get a family doctor in Canada. And when I finally did, it was such a bad experience that I said no, never again. I cancelled everything, walked away. And honestly, I thought I'd suffer from that decision, but guess what? I never ever missed anything. In fact, I discovered something that actually works better. If you're new to my channel, hi! My name is Suliat, you can call me Spicy. I create travel and lifestyle videos about a real immigrant lifestyle in Canada, basically. The beautiful, the stressful, even the funny parts that we don't talk about enough. When I first landed in Canada, everyone told me, get a family doctor, get a family doctor. It was one big topic, and for everyone that you ask about it, they will tell you it's not easy to do that. You're not going to get it early, so you have to register as soon as possible. So I registered, and after I registered, I waited and waited and waited some more for 4 good years. This is not a fun wait because you have to call the 811 number, put in your registration, and then that is when you start to wait. You just keep waiting indefinitely for as long as possible. Whenever I see someone that has been here for years and I ask them, how did you get a family doctor? Refer me to your family doctor. They say things like, we are still waiting. And I'm like, you're how many years here now? And you hear them say they've been here for 5 years or more, and they're still waiting for family doctors. So what then is our own hope? Then one day, out of the blue, we got a call from one family doctor asking us to come register. That was a big deal. We were very excited, the entire family. It felt like we won lottery. We were so, that immigrant journey that, finally something clicks. It was such a moment for us. So we both, myself and my husband, took days off work because we couldn't wait to get to that family doctor's office so that we can register things. So this lady had said to us that the person who had called from the family doctor's office had said to us that, well, we should come with the kids. They're going to do the registration. They're going to ask us a lot of questions. We're going to meet the doctor. She had all kind of information that they needed from us. So we were advised that we could take time off work to do that. Obviously, they don't work on weekends, so we had to go during the week. So we took time off work. We went there. Let's just say it was the worst experience ever. Like, we left that office thinking, no, I'm never doing this again. Apparently, doctors around this part of the world always feel like small gods. This particular doctor left us with very bad taste in our mouth. And we started asking ourselves, why did we do this? Like, why did we even bother? Why was all the wait for all these years? Aside from the fact that it was a completely wasted day, this doctor and his staff generally were very rude, condescending. We left the hospital feeling like we'd never been so, particularly high, felt like I'd never been so humiliated in my life. And this is because this doctor felt, I don't know. I really am not sure what was going through their head, but I realized that a lot of people witnessed what had happened that day and they couldn't say a word because it seemed to them that like it was a normal thing for the doctor and his people to act that way. I did not realize until I got back home and I went online because I felt so bad about how the whole thing went, and I realized that it wasn't personal. Going online and seeing this doctor's review, I have never seen any service or any business get reviews as low as 2.7. This doctor Apparently, it wasn't personal. It was just normal for him to be that brutal. It was just normal for him to be that nasty and unprofessional. So that one experience left a very bitter taste on my tongue. And months passed after then. After I was able to get over that one bitter experience, it occurred to me one day. Apparently, I didn't even need a family doctor. I didn't need to run after a family doctor as much as I've done in the past 4+ years. Why was I feeling like I needed this doctor so badly? My family and I, since we got to Canada, I've been attended to by doctors, I've been attended to by specialists, I've been attended to by registered nurses and really experienced nurses in the past. And so, in reality, we didn't need this doctor. Well, maybe not as desperately as we thought we did. So since we got here, I've never even needed to call a doctor before. Whenever anything came up with the kids or with either of us, fever, questions, or weird, feelings or symptoms, or even when the kids were really, really sick, all I had to do was call 811. Now, listen, this is just one part of what you can do. You see, with this 811, that's the very first step of what you can do in Canada. Generally, I think this number is what works all over Canada. You speak to a registered nurse, they listen, ask questions, sometimes even send you to clinic or an after-hour clinic. No lineups, no queues, no drama. They just help you. And this is at your own time as well. And the best part is when the nurse says you need to be seen, you don't get stuck. There are walk-ins and after-hour clinics everywhere, and they can actually see you. They would also direct you as to the best place to go to, considering your location, your timing, and whatnot. But then I found something even better, real secret. I'll tell you exactly how it works, and it might just change the entire view of healthcare in Canada for you. So let's get technical for a second here. Canada's healthcare or Medicare is publicly funded. Each province controls its own system, and that means that healthcare in Ontario is not exactly the same as the one in New Brunswick or Alberta. Your Medicare card covers most basic medical services, the doctor's visits, lab tests, the hospital stays as well. But the big issue here is the access. Family doctors are scarce. Finding family doctors in Canada is like looking for pin in A. It is difficult. Family doctors are so special in this part of the world, especially for immigrants. So people have to wait for years, like literally wait for so many years to get a family doctor. And that's where the New Brunswick surprised me, because while I was stressing about getting one doctor or the other, the province had already created a system that covers people without one. And I did not know. Now, what is the secret solution? This secret is called the NB Health Link. If you live in New Brunswick and you don't have a family doctor, this program is actually your healthcare lifeline. Let me explain how this works, because this is the part that nobody really tells you clearly. Anyways, once you register online or by phone, you will be assigned a team of doctors and nurse practitioners, not just one. Personally, I don't like having just one medical person, one doctor looking at a situation, because in medicine, I believe that different opinions do count. Let me give you a typical example. With one of my kids, we've had like some health cares in the past, and every time we would go for the checkup with doctors or nurse practitioners, they would always do their own check-ins, run tests, do all these, refer into specialists and whatnot. But there was always one thing that I used to mention to them to check. None of them really did listen to me, which is a very typical thing with a lot of doctors. But there was one time that we now went for a checkup, and this particular doctor actually listened. She actually took her time and was like that. She doesn't think that would be the situation, but just to tick all the boxes and, just to clear things, she decided that they were going to run a test regarding that, and behold, my concerns were actually right. That would not have happened if I had only one doctor that was attended to our family. Because if that was the situation, the doctor that had insisted that that could not possibly be the issue would still stick on not being the issue and would never really look into that matter for us. But because we eventually saw one that was more open to, listening to a novice like me, we were able to get, so having second opinion when it comes to medicine for me is important. This is one of the reasons I'm not really big on family doctors anymore. So going back to these doctors, they will have access to your records, they will follow up with you, and if needed, they would even refer you to all the specialists that you need. What else do you want? And all of this is under the same system. You can talk to them virtually or in person, and every visit is documented so your information stays connected across board. Even without a personal family doctor, you are in the system, you are cared for, you are seen, you don't have to wait. So while some people are still, waiting 3-4 years to be matched, NBL Link makes sure that you are not left hanging. And then the wildest part, the very, very wildest part there, it is free. You are a taxpayer and your taxes are working for you. It is all covered under your Medicare. So, my people, as immigrants, we come here chasing stability, opportunities, safety, but healthcare can be one of the hardest things to figure out, especially when you don't even have extended family or you're trying to, understand new systems. I have learned that access doesn't always mean having a doctor. Sometimes it means knowing how the system works for you. And for my family, NBL Link, 811, and after-hour clinics, they have met our needs. As a matter of fact, we don't even need to keep records. They follow up. Let me give you a typical example. I had to go to the hospital at some point. I called the NBL Link, and they would always call me back. You see that part? They always call me back to follow up on what I've called them for. They referred me to this after-hour clinic, who then referred me to see a specialist that I needed. And I almost got the surgery done, even though I canceled that surgery myself. But if I needed that surgery badly, they would have gone ahead to do it. My child was referred to specialists even all the way in another province. There is no other need. When you have a family doctor, you would still need to only go to them at the times that they are open, compared to when you have like NBL Link that works 247 for you. They are there, they are always open. You can reach them online, you can reach them physically. But with all these family doctors, you're limited to the times that they are open. This particular family doctor that I went to, that we thought that we're going to get, they only worked Monday through Friday from 9 a.m. Is it 9 or 10 a.m.? Let's say 9 a.m. till 4 p.m. in the evening. And if you do not have an appointment, they're not going to attend to you. At least they made that clear. If you're 5 minutes late, you're in trouble. They would fine you. They actually legit have their fine, amounts there. But with this after-hour clinic, what I would usually do is I would simply just call the after hour. That was even when I was still going to the after-hour clinic. At some point, you would have gotten in the system to the extent that you don't even need to go to the after-hour clinic anymore. You do have somebody following up with whatever your situation is. But in this situation, I'd called the after-hour clinic and they had followed up with me. They gave me after-hour appointment that I could come at so time, which worked perfectly for me because I didn't have to take time off work to actually go to them. I went there, I was attended to. There was a time I needed time off work to heal, and yes, I got time off work from after our clinic. Yes. And then for this particular situation where I actually needed to do a surgery, I was referred to the specialist. They followed up with me. They followed up with running all my tests and whatnot. If I had a family doctor, they would have pushed my file back to that family doctor, who I would only be able to access at their opening times. The same opening time they have is the same time that I have to work. So eventually I realized that God have blessed me. God really did bless me with NBL Link, and I was there running after doctors, family doctor that I don't need. Anyway, that doesn't mean that you shouldn't get a family doctor if you want one. It just means that you don't need to panic. There's nothing you're running after. You don't need to have one yet. If you don't have to, you are not hopeless and you are not helpless. There's a whole network that is ready to work for you. My friend who has a family doctor says she's never actually used the family doctor before because they are never available when she needs them. There are times that our son had to be taken to the hospital from the daycare, and the family doctors were not available because it was not their working hour. There was a time she had like emergency. When she called the hospital, the family doctors referred her to go to the emergency. So human beings, we like to chase what is not chasing us. So I learned you really just need to know how the system works for you. You don't have to get a family doctor before you get taken care of or you get cared for in Canada. I think they should have this kind of program in other provinces as well. But this that I'm talking about is about New Brunswick. But the 811 thing, it's Canada-wide. You can get attended to the after-work clinics. You can get attended to. I never wait when I get to after-work clinic. Once I call them, tell them what time I want to come in. They tell me if I would have to wait or not. I look for a time that best fits for me. Anyways, that is how I and my family have survived 5 years in Canada without a family doctor. And honestly, I've never felt more in control of my healthcare. If you're in Canada and still wanting to be matched, explore that your province healthcare link, and I think call that 811. Get on the queue so that at any point in time when there is a family doctor that is available for you, you'll be able to get matched. As for New Brunswick, NB Health Link is that hidden gem that no one is talking about. I hope this video helps you understand the system better. Share it with another immigrant or anyone struggling to find a doctor, because knowledge is everything here. Knowledge is power. So now tell me in the comment section, do you have a family doctor or anyone, or are you even surviving without one like me and my family? And tell me what province you are, whatever app works out in your province. Don't forget to like, subscribe, and join me on my travel and lifestyle journey, where we talk about everything from exploring new places to navigating life abroad and living peacefully and happily and successfully as immigrants. Don't forget to share this video with others. That would help support my channel. Thank you. On to the next channel. Peace out.